Welcome to the Surgical Technology Principles and Practice Skills DVD. In this program, you will have the opportunity to watch surgical technologists demonstrating the basic skills you are learning about in the classroom. These visual demonstrations will provide an opportunity to see realistic examples of surgical technologists performing specific skills in the sterile field.
Incision.
As a surgical technologist, you are part of the allied health profession, trained to have a global view of health and focus on highly technical aspects of healthcare delivery. You are trained to have a distinct expertise, which is both technical and humanistic. The profession and work of the surgical technologist is performed as part of a team approach. Every task and responsibility is an integral part of the larger field of medicine. An important goal for surgical technologists is role integration. A key role of the surgical technologist as a member of the perioperative team is effective delivery of patient care in a safe, efficient, and timely manner. Surgical technologists are concerned primarily with preparing and maintaining the sterile field, focusing on the safe use of technology and the art of handling instruments efficiently during surgery to promote patient well-being. There are four main areas of healthcare and technology relevant to you, the surgical technologist. Assisting in surgical procedures as part of the surgical team. Expertise in preparing, handling, and use of surgical devices, equipment, and instruments. Providing patient care in the perioperative environment. Leadership, management, education, and mentoring. The surgical technologist has many roles and tasks, from basic to complex. In the perioperative setting, these are usually divided into time-oriented organization and include gathering appropriate equipment and supplies, preparing supplies and equipment in the sterile field, maintaining and protecting an orderly sterile field, troubleshooting any changes that require immediate action, assisting the surgeons in their work, having specific knowledge about how instruments are used in surgery, passing instruments and supplies in a safe manner, assisting in the application of sterile dressings and removal of sterile drapes, remaining sterile and on standby, protecting the sterile field until the patient is ready for transportation to the post-anesthesia recovery unit. When it comes to providing surgical patient care, the integrated role of the surgical technologist, nursing, and surgical team helps eliminate patient risks and support the patient's recovery and well-being.
Great, number 2.
Most surgical technologists work in a hospital setting as a member of the surgical team. This is the main role which entry-level surgical technologists are trained to fulfill. It is a complex job involving many disciplines, including basic patient care, organization, use, and care of surgical instruments and devices, excellent communication skills, principles and practice of sterile technique, knowledge of surgical procedures. Other surgical technology career opportunities include specialty practice in orthopedics, neurosurgery, cardiac, obstetrics, or plastic surgery, private scrub assistant, surgical first assistant, educator or clinical instructor, medical industry representative, materials management and sterile processing management, research product and development, agency travel technologist. Although most skills can be learned, characteristics such as honesty, empathy, and caring cannot be taught. Successful surgical technologists have personal characteristics and aptitudes that contribute to high-quality patient care and job satisfaction. Success is defined by positive patient outcomes and a sense that you've contributed to successful care. Perhaps the greatest satisfaction surgical technologists may have is an appreciation for their own professional niche, where they can deliver the best possible patient care, feel challenged but not overwhelmed, and grow professionally. Surgical technologists are often asked to act as preceptors or personal tutors while scrubbed. Serving as a preceptor requires patience and a willingness to share knowledge and experience while mentoring new or student technologists in the operating room environment. Key attributes to success as a surgical technologist include care and empathy, respect for others, emotional maturity, organizational skills, manual dexterity, ability to concentrate, problem-solving skills, sense of humor, honesty and ethical behavior. In surgery, professional and personal honesty about your actions, mistakes, and abilities is called surgical conscience. When any professional makes an error, he or she must admit the error at the time it is made. It is difficult to expose an error, particularly in front of others, but doing so and accepting responsibility are signs of professional and emotional maturity. It is a requirement for work in any healthcare profession.